Good day, global citizens. Welcome to another episode of Dr. Fajimbola's Opinion. This is a platform where research meets understanding and legacy. Today, we have a recurring guest researcher. The first time he was here, he discussed breast cancer. But today, we are diving on another aspect of breast cancer, the use of herbal medicine in the management of breast cancer. And when I was reading this paper, I was like, this is what people should know about. These are things people are not aware about, or maybe they even take these herbal medications for something else entirely, but not for the management of breast cancer. So I believe even our audience outside Nigeria and diaspora will benefit greatly from today's session. Please join me to welcome Mr. Toib Sodiq. Mr. Toib, how are you doing today, sir?
I'm fine. Nice meeting you once again. Thank you very much. And
Thank you
it's nice discussing with you.
And we're looking at some medicinal plants, which our guest researcher will dive into. So, Mr. Toib, what benefits do medicinal plants have over conventional medicine in breast cancer management?
Okay, thank you very much. The benefit of these medicinal plants or herbal medicines over the conventional therapies for breast cancer, before I even dive into that, we have three major therapies for this breast cancer. That's the surgical one, the radiotherapy, and the chemotherapy. But the benefit of these herbal medicine is number one, they have a kind of multi-targeted approach. What I mean by multi-targeted approach is that, in a single medicinal plant, we can have thousands of phytochemicals.
Mr. Toib, one of the highlights of herbal medicines for me is accessibility, especially from where we come from. The fact that we have accessibility to this, we don't have to import it, is not something like matcha tea that is in Asia or any of these Asian plants. The plants in discussion for today are what is in our environments, what we have access to, and majorly not even in our environment, globally, about medications, our stuff we use from our spices to our drugs. They are readily available. So that's one of the things that helps. And in modern day, for example, in Nigeria, in economics that are trying to thrive, we know all global economies, now I'm not going to be biased, all global economies are trying to thrive. But we understand the situation more in Nigeria, how it is like it compared to the minimum wage, how citizens are trying to thrive. This is a more realistic mode of breast cancer management for citizens compared to conventional medications, which they might not have access to, which even if they are using, let's say, chemotherapy, they might not be able to pay, the machines might be down or something like that. So
the oncologist, so that they will assess you and give you the proper medication, because they might be experiencing some toxicity in that medication, in that herbal medicine that is using. So it is advised to tell the person to go and meet the oncologist and give them the normal conventional treatment. That would be my advice.
Okay, thanks for the advice. So what you're saying now is, for example, this patient is in Nigeria, and what you are saying now is if anyone is newly diagnosed with breast cancer, yes, you have access.
That's herbal medicine they've been using together with the normal conventional therapy. It will be good. I explained earlier that there are some herbal medicines that give a kind of synergistic effect. So that herbal medicine might also assist in the efficacy and the safety of that the conventional therapy they are taking. That's what I mean.